Welcome back to Great Day Houston. As you can see, we are not in our studio. Instead, we are in the offices of Justin White and Senior Health Services. Also joining us is Elaine Hancock, who represents a wide portion of our community, seniors. And you know what that means? It means you know everything. Just go with it, Elaine.
Yes.
Yes. But one area we oftentimes get tripped up on is Medicare. And Justin, we know during that period where people will renew their Medicare plans, a lot of times they won't do anything at all because they're confused. But if your life has changed at all, you need to make those changes.
Absolutely. You need to reach out at least one time a year and just do what's called a review. Just make sure somebody looks at your plan and make sure it's still relevant and takes care of the things that you need as your life changes.
Yeah, do you need prescriptions? Do you need other kind of specialty doctors you're going to and all that type of thing? Mm-hmm. There are other times when people will reach out to us instead. Yes. And it's buyer beware. You had a situation, Elaine, where you kept getting these phone calls and you were suspicious of what they were offering you. What were they offering you?
Basically, to make sure I was in the right plan, and that they knew they could save me money. Okay, and who wants to save a little money?
Everybody. Yeah.
And so I listened, but what really triggered me into keeping up with the conversation and talking to him and letting him talk is the fact that he knew my insurance. He knew what insurance I already had.
Yeah. So it sounded familiar enough for you to feel comfortable.
Yeah, I was comfortable with
it.
But then when I got new cards in the mail and I couldn't use my over-the-counter card that I already had, then I got suspicious and called Justin and I said, hey, you need to see this, and I can't.
Yeah, so what happened there, Justin?
Oh, she came in and said, I did not do anything, because she'd been my client for a long time. Mm-hmm. And so she said, I did not do anything. And I said, well, you may not have done something, but they did. And so they messed up her insurance by moving her into a plan. Not only did they move her, but the plan was terrible for what she needed. They took her drug coverage away.
Wow.
You know, and so we had to go through the rigmarole to get it fixed, and we did get it fixed. We had to go straight to Medicare to do that.
Yeah. So they had called, gotten her Medicare number, and then basically used that number to enroll her in another plan and get credit for it.
Right. Yeah, just trying to make a sale or whatever you want to call it at any cost. And we're not exactly sure. She didn't give the Medicare number, but isn't that creepy how they knew everything? So they had access to some database that allowed them to make changes. And then all of a sudden she just has these cards show up. And a lot of people out there know exactly what we're talking about.
Yeah. All right, Senior Health Services, let's back up and explain exactly what you all do.
Well, Senior Health Services is a full-service Medicare brokerage. We work all through Houston, but all through Texas and a bunch of different states. And we just specialize primarily in Medicare. We do a lot of different things, but Medicare mainly, and just helping people to interpret what's going on, what's changing, what your options are, so that they can make decisions. And the brokerage part means that we are contracted with every relevant carrier so that we can sit down and listen very closely to what they're saying and not care what the solution is, because we're not having to shoehorn them somewhere. We're putting them in the right plan for that point in time.
Yeah, this right here points out how important it is to have a relationship with someone who can explain this to you.
That's exactly right. Because you called me and said, Justin, right?
Right, because you don't know that you're really talking to somebody at a desk on the other end of the line. You could be, they could be sitting in their kitchen having toast. Who knows, you know? But I like the idea that I can call Justin or come over, or just pop in if I want. Right. But I don't do that. But
well, you could. But she is a rock star, because to fix this, at my direction, she called Medicare and explained it to them and got it straightened out. And that's the main thing. You got a problem, you reach out. Don't settle for that stuff. Don't let them get away with that. Reach out so we can work on fixing it.
How often should somebody review their plan?
Every year.
She knows.
Every year.
Every year. So every year. And again, what we're looking at is, did your prescription needs change? Did your health needs change?
Is your doctor still in the network? Did are the benefits the same,
and
et cetera?
It's changing all the time, and we don't get younger. and things can change overnight.
Yeah, yeah. All right, you mentioned we don't get younger. In fact, the baby boomers are coming in hot. In fact, these services are needed more and more and more. And Justin, you're actually looking for people with a heart of service who would like to either start a new career or start a career for the first time and be of help to people like Elaine.
That's exactly right. And there's a lot of opportunity right now because we've seen what the market's been doing of late, right? And so a lot of people are looking around, whether it's they want to go out on their own or earn a little extra money, whether they're retired or whatnot. We've got a couple agents that recently turned 80.
Oh, wow.
And they're working when they want to and making some extra money and helping people.
Yeah, all right. So I'm going to end with a question that comes up often. I get stopped on this one all the time. They say, we saw that man on your show. So the enrollment period typically is between October and December, but I don't turn 65 until later. So do I have to wait until October? Like one person, for example, is turning 65 this month. Says, do I have to wait until October to do anything?
That's a great question. And the answer to that is no. When you turn 65, you've got carte blanche to do whatever you want to do, right? And that's the same thing if you're new to Medicare and you're retiring. So when you get to that where you're going into the first time and you turn 65, it is absolute go time for them to get something and start getting their stuff together so they can get into their first plan. The October time frame is just to make changes, and that's the time of year most people will make changes.
When you get into that plan, you all will sit down and explain it to us. I'm not there yet, but when I get there, explain it to us because again, as we mentioned, it can be confusing. It's after all, it's a government program, right? So, but you can explain it to us and about what's best for us.
That's exactly right. Well said.
Thank you very much. Several businesses charge for their help, but again, Senior Health Services is free and they offer more than just Medicare consultation. If you're looking for help or would like to join their team, give them a call at 281-894-7540. Again, that number is 281-894-7540. You can also visit their website at seniorhealthservices.com.